Hello, this is Decision Making in Health Service Management, and we'll be comparing the use of nanotherapy to treat lymphoma to the use of phage treatment for leukemia in same health. The decision makers are James Azem, Chukwunonso Asibogu, Fifina Jiju, Chinye Ofulue Temitayo, Mohamed Oladipo. The introduction. According to National Cancer Institute, cancer is a collection of a group of related diseases, which is characterized by uncontrollable growth of cells. It can occur in any part of the body, such as the lungs, brain, and liver. Cancer can be divided into six distinct groups according to their histology, and this comprises of carcinoma, myeloma, sarcoma, leukemia, lymphoma, and mixed types of cancer. Statistics from the Australian Institute of Health and Welfare promotes better health and well-being show that promote better health and well-being show that 2008 to 2012, 20,200 were already living with lymphoma. And in 2014, about 1,598 died of the disease at the rate of 9.3 deaths per 100,000. Generally, normal cells in the human body grow, divide, and die when they become old or damaged. But in the case of cancer cells, there is uncontrolled growth of cells. Many types of cancers can form tumors. National Cancer Institute. Leukemia are cancers originating in the blood, forming tissues such as bone marrow, while lymphoma originate from the cells of the immune system. New and promising research shows the possibility of effective treatment by both lymphoma treatment for both lymphoma and leukemia, pardon me. One of such therapies is gold nanoparticle therapy, which we'll be talking about today and comparing it with the phage therapy. For the purpose of this analysis, we'll be talking about nanotherapy treatments, which we have chosen over the phage treatment. And the reasons why we chose this are no known side effects has been recorded. It's used to treat lymphoma and other forms of cancer, such as melanoma, which has been predicted to have an increase in prevalence, especially in age group of 40 to 44 years and 75 years and above. Both age groups, which comprise of the highest projected population in females community. Nanotherapy costs about $4 million used for treating 520 patients annually, while the phage therapy costs about $3.3 million used for treating about 350 patients annually. This data gotten from the proposal by the two doctors. Benefits of gold nanoparticle in cancer treatment. Gold nanoparticles can change biological processes. They are versatile and can adapt in different geometries to suit the particular treatment purpose, and so it's useful in cancer treatment. Nanoparticles are prepared from natural and synthetic polymers, and so they are stable and free of surface modification, thereby making them apt for use in treating cancer. Gold nanoparticles permit for efficient and effective uptake by different cells and selective drug accumulation at target cancerous cells. Gold nanoparticles are appropriate for intravenous delivery and do not form particles nor clots, which prevents embolism. We'll be talking about the strengths, weakness, the opportunities and threats of using gold nanoparticle therapy. The strengths. Biocompatibility. The procedure uses gold particles which are biocompatible, as such, it does not have side effects unlike other procedures such as chemotherapy, which is widely known. Versatility. It's useful and effective for detection and removal of residual cells after large tumors have been removed. Specificity. It selectively targets and destroys cancer cells, lymphoma inclusive, unlike chemotherapy and radiation therapy, which are harmful to the normal cells. And then other applications such as possibility in the use for treatment of heart disease. Weaknesses. It's not viable for large tumors. Opportunities, novelty. It's a new field, so it opens the door to new ideas and therefore potentially helps to cure many cancers. For example, the advanced melanoma. Attractiveness. This effectiveness of the treatment, as seen by curative effects within 8 months, gives patients a better quality adjusted life years, thereby giving it an edge above phage therapy. Threat. There are alternative treatments, and then there are restrictions to the use of nanotherapy. Furthermore, we'll be talking about the economical justification for choosing nanotherapy over the phage treatment. And the first economic tool we'll be using is the cost benefit analysis tool, where we compare the two forms of treatments. As a result of the cost benefits both treatments provide. Nanosurgery. The cost benefit analysis from nanosurgery is gotten by the benefits, which includes the multiplication of patient fee and total number of patients per year, divided by the total cost. The benefit of 520 patients by $130,000 per patient divided by 4 million in total gave us about 16.9. While the phage therapy, the benefit of about 350 patients with 53,000 per patient divided by the total cost of 3.3 million gave us 5.6. From this calculation, the benefit from having to use the nanosurgery at 16.9 is higher than 5.6, which makes it 5.6 of the phage therapy, which makes it a better option to use. Second economic tool we'll be using is the quality adjusted life years. Using data from the documents provided, we compare the quality adjusted life years gotten from the use of nanotherapy and that of the phage therapy. The quality adjusted life years for treatment A, which is the nanotherapy, equals the life expectancy of 5 years, which was indicated in the documents for the nanotherapy, multiplied by the utility value of treatments from using nanotherapy. This was also given. The multiplication resulted in 3.80, while that of B was the same formula using the life expectancy to be gained from using a phage therapy, multiplied by the utility value of using a phage therapy, which was 5 multiplied by 0.59, which also gave 2.95. Comparing both treatments, the quality adjusted life years gained was higher in nanotherapy as compared to that of 2.95 in phage therapy, which makes treatment A, nanotherapy, a better option for the patient than the phage therapy. The third economic tool we'll be using is discounting. The discount rate offered to the patients of both treatment using the allocated patient fee was used to find the discounting rate. The calculation here states we had to find the interest rate first before we could be able to identify the discount rate. And then we got that with the use of price of the first year and then price of second year, and then multiplied it by 100 to get the interest rate. The interest rate gotten from nanotherapy was about 5.4%, while the interest rate gotten from phage therapy was about 3.7%. But then the higher the interest rate, the better the discount. And the higher the discounted rate, the better the offer for the patient. Therefore, nanotherapy, which had the higher interest rate, would definitely provide a better discount, which is a better option for the patients. In conclusion, using the economic evaluation tools of cost-benefit analysis, quality-adjusted life years, and discounting method, nanotherapy, amongst other methods, nanotherapy proved to be a better treatment option. Aside its economic advantage, nanotherapy is expected to treat melanoma amongst other forms of cancer. Thank you.